Hello, I'm Ana González, researcher at the Universidad Politécnica de Madrid, part of the Information Processing and Telecommunication Center, and I'm going to present the paper Building Digital Health Systems to Support Treatment Administration, a preliminary case study.
In the last decade, the management of health conditions has changed with the emergence of digital health systems. These systems are designed to improve patients' care and disease management through the use of digital technologies. They also have the potential to impact strongly on chronic and long-term treatments, both for patients and clinicians, improving the disease follow-up. However, this kind of scenario raises a specific challenge. For example, due to the long-term nature of the treatment, it may be harder for the patients to maintain active in this type of technologies, which is the key to maximize the potential of these systems.
Digital health system can be used for diagnostic, treatment, even cure. Although there are several studies related to this system and their effectiveness, none of them give concrete effective guidelines to improve them. Studies often refer to one of these terms, adherence. Adherence is understood as that users use the system as recommended by the clinicians, providing the required amount of data. Usability, defined as the facility to understand and use the system. And finally, usefulness, understood as the perceived effectiveness of the system by the users. We want to approach all of them in a single model, taking into account that they all are related and must be taken into consideration in order to improve the system. Understanding that adherence, usefulness, and usability are closely related, impacting one over the others, we can assume that to foster high adherence, the application on the patient sites must be perceived as a valuable tool, effortless to use. From the literature review, 27 types of strategies related to adherence, usability, and usefulness were collected. Following this, we organized the main strategies in 4 different groups, depending on what it is in. As a result, we have defined the following adherence model that should be considered in order to build a patient-oriented application. The different objectives are: Objective 1, incentivize data entry. Those strategies to get as many data as possible, such as notification and reminders delivery or connection to electronic device. Objective 2, facilitate the application use. These are strategies related to enhance usability. These mechanisms prevent to user fatigue that could cause the abandonment of the app. Objective 3, extending information. Those ones related to enhance usefulness, such display information of interest or provide supporting exercises. And finally, support behavior change. These are strategies which aim at changing the pattern of behavior, such as motivational message, personalized goals, or social comparison. The identified objectives are not exclusive one against others, which means that in many cases, its strategy is not only supporting a single objective. In most of the cases, they can be related 2 or more objectives, as can be seen in the figure. The concept model for adherence has been applied to build a digital health system for patients with kidney failure following peritoneal dialysis. Under this treatment, clinical follow-up and medication adjustment requires patients to track their treatment guidelines several times per day. The peritoneal dialysis is performed introducing a fluid into peritoneal cavity through a catheter placed in the abdomen. To avoid excess of fluids in the abdomen, patient needs to carefully control the amount of fluid infused and drained through the day. Treatment reviews are usually carried out at a regular doctor's appointment, but this system provides the opportunity for real-time follow-up. The developed system relies on a mobile application on a secure backend server accessible to the professionals in charge of the patient's management. The principal mechanism used to data entry is notification. Also, to facilitate the use of the app, we will apply a minimalist design, a language adapted to the patients, confirmation requests to send data, avoiding errors, etc. Regarding extend information, we will implement the capability of sending and dispatching personal data, communication with the clinician, and also the access to health information about peritoneal dialysis. Finally, to encourage behavioral change, we will carry out the data analysis to obtain indicators of patients' condition to report their evolution, and also to alert the doctors in case the therapy needs to be reviewed. The developed system has been under validation during a short period of time in 2 different stages. This validation should be considered preliminary due to the limited number of subjects involved, but it allowed to get some valuable feedback to determine next step to take. In the first stage, 2 volunteer patients and 2 doctors were using the first resulting system for during a week. Right after, they evaluate the usability and the usefulness of the functionalities. The scores of 4 individuals were favorable. Usability obtained an average of 4.15 of 5, and the functionalities obtained 4.6 of 5. However, as expected, users differ in their interest. For example, as we can see in this figure, patients find the use of notification more useful than doctors, while doctors find more useful than patients have access to their therapy information. These small discrepancies confirm the importance of considering both stakeholders, patients and clinicians, in the design of the system, because they may have different viewpoints of the same functionalities. After this initial pre-evaluation, certain styles were adjusted and new adherence strategies were included, such the possibility of customized personalized notification. For the second stage, 6 patients start to use the application. We analyze their patterns of use with different functionalities. The levels of use of the application by the patients are favorable. The average percentage of days those users have submitted data on their therapy is more than 90%, with a standard deviation of almost 14. This shows that the patients of this small trial have used the application almost constantly, which indicates very high levels of adherence. The proposed adherence model shows good results in the small validation carried out. This validation is very limited by the number of participants, and there is still a need for more extensive validation. However, the model and the guidelines given are the result of an extensive review of the literature and our experience in this area. To conclude, we will see the main guidelines to take into account in the design of digital health systems. First, it's necessary to start the design with a retrieval of relevant patients' information, understanding the current patients' practice and adapting their language to them. Then, we have to analyze the importance of its clinical practice and translate it into application features. It's also necessary to carry out design reviews and consider their request. We have to analyze how to integrate digital health system into the clinical pathways. This implies dealing with extra interaction in organization terms, such, for example, with supervisors, nurses, or doctors. Finally, the model has to be applied into increase adherence for patients, but also for clinicians. Clinicians' adherence is important. As being a two-side system, patients will only perceive full usefulness if the doctors are paying attention to their data and the communication is fluid. By following these guidelines, it's possible to design a digital health system to facilitate the work of doctors and thus improve the patient's healthcare.